Hello, everyone. Happy International Women's Day. I want to thank you all for being here today, whether you're joining us here in person or online. I appreciate you taking the time out of your day to come and receive this training. I know that mental health and suicide are not fun to talk about. Crisis, and the construction industry is not exempt from that. Once again, I just want to thank you all for being able to introduce our speaker, Bridget Battafarano. Bridget is a community alliance. For those who don't know, Community Alliance provides person-centered integrated healthcare to support both mental and physical health. Provide a large range of services from primary care therapy and psych medication. They also do housing and homeless outreach, and they also have a group-based rehabilitation program. Community Alliance recently received a federal SAMHSA grant to help respond to suicide risk among adults 25 or older. This grant allows them to offer case management services, therapy, and free evidence-based trainings that are developed by the American Foundation for Suicide Prevention. Bridget told me that last February, Community Alliance has trained over 2,000 people and served over 70 clients in need. Let's all give a warm welcome to Bridget Battafarano.
Stand up using this chair because I'm pretty short. But thank you for the introduction. I've never gotten such a formal introduction before, so I appreciate that. Happy International Women's Day. This recent by the American Foundation for Suicide Prevention workplace. And while may or may not know that construction is one of the top industry. So it's a really important presentation. I'm glad you guys have accepted. We get started. So suicide is not a fun topic to talk about, right? However, it affects millions of people every year. And yeah, so it makes it very important to talk about. I am a volunteer with the Foundation for Suicide. We're partnered with them through Community Alliance and through that grant. And I really hope that you can learn some about suicide prevention, maybe how to implement some policy in your field, in your organizations. And then I know that this is a really sensitive topic. So if you need to step out for a minute, if you need to take time to or distract yourself or whatever you need to do, please feel free to do that. I know that this affects many of us personally in one way or another. So let's get started. In this presentation, you're going to learn about the scope of the problem of suicide. You're going to be able to explain the key research findings. We'll look at risk factors and warning signs, how to seek and offer support for yourself or others you know. And then also you'll get access to crisis resources and services. These can help you or somebody else in crisis who you know. A lot of different ones, and then we'll just go through some of the options. We'll also talk about prevention and what we do. well, suicide can be prevented, and I think that's really important because a lot of times what we get from the general public is that suicide is something that, well, somebody decided to do it, they're gonna do it one way or another. And that's not true. So we can prevent suicide. When we talk about suicide matters. So some language do's and don'ts, we're all on the same page. We want to avoid saying things like committed suicide. Committed have a really negative connotation. We think about people talking about committing sins or committing a crime, right? And for the people who have made suicide attempts and also for people who have lost someone to suicide, that's not a connotation we want to bring for them. Especially because someone who's lost someone to suicide is at greater risk for suicide themselves. And then failed or successful attempt, these imply judgment, right? And so we just want to avoid saying that and say instead, suicide attempt, a death by suicide, someone ended their life or killed themselves or died by suicide. Also want to look at some terminology that might come up during this presentation. A suicide loss survivor or survivor of suicide loss, suicide bereaved, or bereaved by suicide. These are all terms that are used to refer to people who have lost someone to suicide. Lived experience is going to be a term that's used when we refer to a person who has made a suicide attempt or who has struggled with suicidal thoughts. Okay, even if acted on. Oh, which are the following options? My cousin Kevin committed suicide. That makes me so let's go over the scope of the problem then. Suicide is the 10th leading cause of death for adults in the United States. In 2019, 47,511 people died by suicide. It's the for teenage adults. 37,503 adults died by suicide in that age range. And rates increased a lot from 2000, which was the 20-year mark the last time they collected that data. Obviously, suicide is going to affect individuals, community members, churches, neighborhoods, schools. And so because of that, right, it has a large impact. Over 800,000 people die by suicide worldwide every year. And so rates in the United States are recorded by the CDC. We're all more familiar with them since COVID started. And aside from being the 10th leading cause of death and the 4th leading in work-aged adults, it is also shown that more people die by suicide than in car accidents, homicide, and natural disasters combined. And it's also, interestingly, the 2nd leading cause of death for youth. So anybody ages 10 through 24. So, following up, correct? Some ideas that you might have about laws, like figure out. Thinking about, but what are some of the causes? You guess. Financial, okay, so like events. Yep, relationships. Yeah, mental health. Yes. so these are some of the examples, right? And it's important to note that when people do take their own lives, it's not for any single one of those reasons, right? If I get a divorce and I'm otherwise pretty well, that's almost never going to result in a suicide. There's almost always other factors at play. So, research has helped us to better understand the perspective of a suicidal person in that a crisis point has been reached, right? People are desperate to escape pain, whether that's physical, emotional, mental, and or both, right? All three. And their thinking becomes really limited. If you've ever been to a therapist or a psychiatrist, you might have heard the words cognitive inflexibility. And that is when we are so preoccupied with what's in front of us that we can't think about anything else. We sort of get tunnel vision. If you've ever had a panic attack, you might know what that means, right? Not able to focus on anything outside of ourselves, and that we have like a one-track mind, right? Most people who are suicidal are ambivalent about ending their lives, right? Yes, part of them wants to die, but also part of them wants to live. And so that's informed a lot of research because we can do things like disconnecting people or helping people create distance from the things that are contributing to that want to die, right? To that impulse to harm themselves, and then also connecting with those reasons for living, right? Brianna noted in the introduction that we have a care coordinator who's a case manager, who her job is specifically to help people connect with reasons for living, and to create that distance from things that might spur that impulse to. So helping people get connected with income resources, helping them get connected to social outlets, helping them to form connections with professionals, right? So all of these things, get a cell phone if they don't have a cell phone, right? We work with a pretty, what would be considered like an indigent population. So people who don't have much. And so that's something that she specifically works on with them. So, just for context, time is a really critical life-saving measure. So if we allow time between the person and the means that they're going to use for suicide, we can prevent that suicide. Even if it's just for a few minutes, that can still prevent the suicide from. See. Okay, that's all right. So that just goes into more of the research, right? And I can send this presentation out so that you guys can access the videos and more information. Also, I believe this video, as well as lots of others, are available on the foundation's website. So it's afsp.org, and all of you have a copy of the outline, the regular presentation, and that will have the website on it as well. So let's go through some risk factors and warning signs, because these are the things we can actually look out for in ourselves, in others, to really know when we should intervene, right? So the risk factors can categorized into three major categories. Those are health, historical, and environmental categories. And each of these converge at different times in people's life to increase risk of suicidality. These are things that generally last over a longer period of time. So, like we said, mental health conditions contribute to suicides. Most people who die by suicide do have a mental health condition at the time of their death, whether it's been diagnosed or not, whether it's been treated or not. Some really prominent ones are depression, right? That's the one that we're going to associate most with suicide. It is the most commonly diagnosed and found in people who have died by suicide. Anxiety and bipolar disorder have shown to be high risk, as well as substance use disorders. If we think about suicide, usually at people's brains for after, when we look at people's brains and we study this, we follow how they end up dying, right? And when we look at that, for people who have died by suicide, their brains have less development, or differently wired in the areas related to impulse control and crisis like management, right? Or level of the ability to manage crisis, right? So what that means is when somebody's in a crisis, even though it might seem small to somebody else, if they're also impulsive, right, that's going to increase the chance that they're going to do something to harm themselves, right? With that, we also know that substance use disorders and things like bipolar disorder are conditions and diseases that inhibitions get lowered, right? And crisis seems more intense when it happens. Physical health factors that you might encounter would be serious or chronic physical health conditions, including like chronic pain, traumatic brain injury that require a lot of care from other people. People might feel like if they're depending on someone else to do their care, that those people would be better off without them. Even though we know that's a lifelong burden to bear, right, when somebody dies by suicide. So, often, like, they have no choice, they feel like they're trapped, or they feel like they're just a burden to others. In terms of historical factors, if you have a family history of suicide, even if it's not your immediate family, you are at higher risk for suicide. A family history of mental health conditions, especially if you've lived with that, can put you at higher risk because of the influence of having to deal with that, right? Past trauma, such as childhood abuse or things like PTSD from any kind of trauma, but specifically like combat trauma for veterans. Has anybody heard of? So the ACEs, you can take a survey, but basically they did on how to identify like what people end up encountering in adulthood that's harmful, right? Diseases, mental health conditions, chronic illnesses in particular, lowered immune systems, all these kinds of things. And what they found is that people who have been through adverse childhood experiences in particular have a much higher rate of having more than one of those chronic conditions, okay? More than one of those risk factors that are physical. So for people who are in those situations, who have lived with someone with an undiagnosed or untreated mental health condition, who have experienced childhood abuse or a lot of trauma or neglect, a lot of yelling in the house, unstable living conditions, are at higher risk. And then, of course, if you have a previous suicide attempt, you're at risk for suicide. That said, most people who would make a suicide attempt are not going to die by suicide. Same thing with mental health conditions. If you have a mental health condition, it does put you at higher risk, but most people who have a mental health condition do not end up dying by suicide. Health factors include things like access to lethal means. That could be a car, that could be a bridge, that could be lethal medications or medications you can overdose on. Exposure or contagion would be exposure to graphic or sensationalized suicide. And because of that, if you have other risk factors, one person who dies by suicide can then trigger other people who have a lot of risk factors to then seriously consider it. And then stressful life events, like you guys said, prolonged stress, so things like continued unemployment or nasty legal battles, things like that. And then work and job strain. So because job insecurity in workplaces, lack of autonomy, so inability to make their own decisions in the workplace, lack of variety contribute, so doing the same thing day in and day out. Work and family conflict, so things like not feeling like you have enough time to spend with your family, not feeling like you can go to work because you have family, things that are going on, whether that's health-wise or otherwise. Heightened job dissatisfaction in certain areas. In a job, like you can't move up or you can't get out of it, even if it's not good for you. And then work that's not meaningful or rewarding to an individual. So, somebody might know that maybe somebody has been through a recent course, or they've been experiencing more stress at work, and then they die by suicide. So it's easy to assume that those factors are the only factors, right, that contributed to that death. What happens in reality is that it's a lot of factors, right? Like I've said, so maybe they also have family history of suicide, also have depression, and maybe they were drinking more than usual, right? Crises don't happen overnight suddenly, right? Crises happen with the buildup of lots of different factors. So we can also look for warning signs. Warning signs are things that are telling us that there might be more immediate risk for suicide. Okay, a lot of these relate to risk factors that you see in people who have depression, or symptoms that you see in people who have depression as well. So the three categories here are talk, behavior, and mood. These are things that we can all recognize in people and observe. So talk would be people saying things about ending their lives, having no reason to live, being a burden to others, feeling trapped, unbearable pain, right? We've already talked about those. Some things that might not be quite as apparent to people are things like, gosh, I really just wish I could not wake up in the morning. Or I feel like I could just crawl into a hole and hope I just never have to come out, right? Also, things like going silent on social media. If you see somebody actively posting and then suddenly go silent, that might be a time to check in. Also, if somebody's posting these kinds of things, or if somebody's joking in front of you or online, making statements about this, it's a good idea to check in, because whether they post it as serious or say it as a serious thing, or they're joking about it, sometimes people feel it is as a joke, right? Because to say it as a serious thing would be too, right? So it's important to check in on these people, and we can look at later how we might check in on people. That can show a warning, or that can be warning signs, are things like increased use of alcohol or drugs, drinking in excess, right? these things, like I said before, decrease inhibitions, make you more likely to feel like you're in crisis. That's going to be a contributing factor. Issues with sleep, either sleeping too much or appearing to hibernate, right? Or excuse me, appearing to hibernate, sleeping too much, or appearing to have like insomnia, not being able to sleep, staying up all hours, especially if people are staying up all hours and they don't seem tired, right? Because bipolar disorder is one of the things we mentioned before. And if somebody's having a manic episode, which is part of bipolar disorder, they often will feel like they don't need to sleep. So that's a risk factor as well. Acting recklessly, so maybe they're having sudden difficulties getting along with coworkers, or they're getting agitated more at work. Maybe they're having issues with HR, they start showing up late all the time, or they're having a lot of discipline that needs to happen at work, or declining work performance and attitude. So things like not showing up, right? Or like I said, not being on time, or maybe somebody usually takes a lot of shifts and suddenly is not taking almost any, right? These are things we can look out for. Also, withdrawing from activities, especially activities they might usually enjoy. If you have workplace gatherings like happy hours or things like that, they usually go to them and suddenly they're just not showing up anymore. Isolating from family, friends, coworkers, changes to their physical appearance, excuse me, especially hygiene. Right, somebody who's usually dressed really professionally or has it together in terms of wardrobe or hygiene, and then suddenly seems to be coming in with like their hair is messy, or they, they're wearing mismatched clothing, or their clothing seems really disheveled, or maybe it smells sometimes, right? These are sometimes signs that people are starting not to care about what they look like or how they present themselves. And then obviously people searching for a way to kill themselves is something we should look out for, especially if somebody's looking to buy a firearm and they haven't before, they don't own one currently, that's something to look for. And then if people are giving away their possessions, Marie Kondo inspired lots of people to go through their possessions and take out everything that doesn't inspire joy, right? So we have seen a lot more of that, right? However, if somebody has something that is really important to them, for instance, like my cat, right? If I suddenly try to give a family member or a friend my cat who I love, people should really, because that would be very, I love my cat. So things like that, or a family heirloom that they're really attached to, or something like that. That would be a really good thing a really good time to check in on them. Because that might mean that they've made a decision to go and they want their things to be taken care of before they go. And then we can think about mood as well. People seeming down or depressed or apathetic, right? Really not caring or being interested. Maybe they usually give a lot to their work, or they are really interested in the topics at hand, and they just lose that enthusiasm, or they suddenly start making space at work. Rage, anger, and hostility. These are things that mostly, when we see them, we just get annoyed, right? We just say, oh my gosh, they're being so frustrating. I can't do this anymore. I need to take a break from them. Like maybe they need a vacation, right? Or that irritability or easily impulsivity. All of these things can just be annoying, right? And things that make you want to avoid the person. However, if somebody is having heightened, that's a good time to check in, right? Hey, I've noticed, things have been off recently. Are you okay? Like, is there anything like you want to talk about, right? Because having that conversation, even if somebody's not in crisis, can really let them know that you are there, right? If people are anxious, worried, or nervous, obviously that's going to be something to look for. And then if they seem really humiliated. So access to lethal means is which one of these factors? Say it again, C. Yeah. So prevention. So research has given us lots of opportunities to develop prevention resources. Access to mental health care is really important if you have insurance. Your insurance is no longer allowed to deny you coverage because they think it's a pre-existing condition. Mental health parity section of the Affordable Care Act closed a lot of loopholes that were in laws about that, which is great. If you don't have insurance, obviously, or you don't have access to a mental health professional, which is a problem in Nebraska, and elsewhere in the country as well, particularly in Nebraska in rural areas, it's really sparse access. But these things are improving, especially with access to telehealth, and things like online resources that have therapists available who are just available anytime, right? Social support, unity, connectedness, these things are important. Effective coping skills, right? If I can cope with something that's minor and continue to cope with things that come up, and I'm noticing those things, I'm better protecting myself. If I'm in a place where I don't notice and haven't been coping along the way, that's going to build up, right? More like crisis situation. And then a positive attitude toward mental health treatment as well, of course, because if I'm not willing to go to mental health treatment, right, if that's weakness or I'm afraid of the stigma, or I think that's for crazy people, right? I'm less likely to seek help. And that can be a problem, right? Problem solving skills are really important. If I can think of 6 ways to solve a problem when I'm doing well, then hopefully I can do. I'm not doing well. Cultural and religious beliefs that I'm training to have something for, right? Feeling a sense of purpose. And also that discourage suicidal behavior without putting shame on it. These can be protective. Self-care. How many of you practice some self-care? That recently, and it was wonderful. Also things that are just like normal life things, right? Like I need to go on walks and exercise regularly. It helps me regulate how I feel. If I stop taking my medication for mental health, that's not going to be helpful. But part of my self-care plan is taking my medications, right? Walking the dog, spending time with your family, doing things like puzzles if you like puzzles, or creative outlet, or sports, whatever it is, or just watching trashy TV, whatever it is, that feels like self-care to you. It's important that we do that regularly. And then limiting access to legal means, right? So if you're worried about someone, you can do that in a lot of different ways. If you're afraid that someone might use medications to overdose, you can ask that a doctor only provide enough medications to get through the next few days instead of medications, enough medication to potentially overdose. You can also ask pharmacies to, or ask your doctor when they put in a prescription to tell the pharmacy you want it in a bubble pack. Why would a bubble pack be helpful? it takes a lot more time to get a lethal dose out of a bubble pack because they're really annoying and they have that thick foil on them. And that's time for somebody to get really frustrated and not do it. That's time for somebody to get a text or a call, or for someone to walk in the room and check on them, right? Time is so critical, right? Even if it's commitment. Mental health care obviously is really important. So being proactive about our mental health, making it a priority, seeing a mental health professional to get an evaluation if you're worried about yourself or somebody you love. Recommending that. How many of you have EAP services available at your jobs? Okay, so EAP services are really important when we talk about job sites, and it would be good to consider bringing that up in your workplaces if you don't have one, because then it gives an opportunity to present to staff that it's not stigmatized here, right? You can access it, access to therapy for usually a limited number of sessions, right? But at least something to let people know that, hey, we care about this. You can have these for free with your work. And if you decide you want to continue, your insurance could help you cover it, right? So it is helpful to at least give people that option, right? Assessing treatment options, there's a lot of different options out there. It's really whatever works best for the individual. I see more of a spiritual advisor than a psychiatrist, right? People have all different combinations. Maybe people aren't ready to go to a therapist, that's okay. But there's a lot of options of ways to address this. Safety planning, things like that. Social support and community connectedness, right? A positive and supportive relationship. Right? Like I said, EAP is a great option. Making sure that we give those options for people to create connections with their coworkers. And then also offering people a place of purpose, right? Encouraging people to notice the difference that they're making. Whether that's, you know, being or administration, right? Really important to make sure that each individual knows that their work is appreciated. And that we're going through this together. It's a team project, right? Through some of these. If the one thing I didn't mention is eating right. I eat like John. I tend to feel like John. I don't know about anyone else. But that's really important one for me. I guess we also didn't talk about sleep. But we talked about what are two of the factors that increase the chance of a person might die by suicide. Brain being trend. Impulse control and crisis response. When you get less than the appropriate amount of sleep, what happens? I don't know about everybody else, but I'm much more likely to snap with people. I'm much more likely to feel like a little thing is a really big deal, right? So important to manage our sleep as well. Want to limit access to lethal means. So researchers have come up with trying to develop carbon monoxide sensors in cars so that we can get the car to automatically shut off if those carbon levels get too high. Blister packaging for medication we talked about. Barriers on bridges have been proven to reduce risk of suicide for entire regions when they are used. And then obviously securing firearms. In Nebraska, about how many people would you guess die by suicide that uses a firearm. About 50%. Also, about 50% of all firearm deaths in Nebraska are suicides. So it goes both ways, which is scary, right? And there's a lot of people in Nebraska who own firearms. So secure, proper security of those firearms, obviously separating guns from ammo, having things locked, is really important. You can also, depending on where you live, in the sort of regulations in your area, you can potentially give your gun to a family friend or somebody who you know is going to keep it secure, or take those from people, if they're willing to give it to you, obviously, for people who you're worried about. Also, almost all gun ranges will take your guns and keep them for a while if you're at risk. Most of the guns on-site suicide death, so they're pretty serious about protecting people. The other thing is, you can always take them to your local precinct or police. That's obviously not necessarily an option that a lot of people would go for, but it is an option, right? Mental health care, protective family, not making so physical, emotional, care for yourself, reaching out to trusted family and friends, making sure that if you're not feeling great, that you've actually sent that text or made that call. Seeking help from a mental health professional, right, like therapist, psychiatrist, a psychologist can do evaluations. These are obviously important steps you can take. Want to watch for signs in both yourself and in other people. Want to reach out and have an honest conversation about mental and how something's doing. And then you want to seek help, share resources, offer to drive them if you know them well, say, hey, I'll go with you, right? That makes you feel better, these kinds of things. Behavior, right? We already went over. When we reach out, there are good ways to reach out, and there are less good ways to reach out. So, minimizing people's feelings, telling them, oh, well, it's not that bad. At least you have this, you know, you've got all this other stuff to live for, right? Not helpful when somebody's in a crisis, right? Convincing people that life is worth living, right? Philosophical debates. We talked about that tunnel vision, not going to be particularly helpful when somebody's in a crisis. Again, giving people advice on how to fix it. Oh, well, you should just go on more rocks, and you should, you know, make sure that take a medication, right? If somebody is going through a mental health challenge and it's not a crisis, all three, or no, not all three of them. The last two are great, right? But that if somebody's in crisis, minimizing somebody's feelings, life worth living, fixing the problem, not going to be helpful, right? They can't see that right now. What it is important to do is talk to somebody in private, listen. Listen more than you speak, right? Let them know that you're hearing what they're saying and not what you want to hear, right? Expressing your concern and caring, letting them know that over and over again, right? If somebody comes to you once, or if you reach out once, maybe somebody's not ready for it the first time, ready to accept that. It's really important that we keep trying. Want to encourage people to seek help. And we want to ask directly about suicidal thoughts. What is a common thing that people believe about asking directly about suicide. What's that?
The idea.
Yes, but they'll introduce the idea. Research shows that's not true, right? If somebody has risk factors and has been in crisis, that's already crossed their mind, right? Not to increase some. Right? They know that that's not. So, asking directly saying, I want to ask you a personal question. Have you thought about killing yourself? Has suicide ever crossed your mind? Right? We don't want to ask, have you thought about harming yourself? Why would that be? Harm is different than suicide. Yeah. Person who got suicide doesn't want to harm themselves. They want to end them. Right? So harming yourself is a different thing. That also might be a good question to ask in terms of somebody's mental health, right? So that you can get them to help. But it's not going to indicate whether they have had thoughts of suicide, right? They might say, no, I've never thought about harming myself. But if you ask them if you thought about suicide, they might say, yeah, well, the other day I definitely looked at that pill bottle and said, what would happen if I took all of those, right? And then, like I said, encourage people to seek help. With this, except that I really want you to focus on thanking the person for sharing this vulnerability with you. Because this is not an easy conversation to have when you're on the calm side of it, right? When you're on the concerned side of it. Imagine how much harder it might be to have this conversation if you're feeling those feelings and it's scaring you and you won't understand and you feel like it's really important. Somebody expresses to you and confides in you these things that you thank them for that. Right? Thanks so much. These are a lot of the resources you can find. Primary care providers, you can go to them to seek help. They can connect you with someone who can do an evaluation. Psychiatric hospitals, if crisis is really intense, you can send somebody to the ER and they can hospitalize them. There are walk-in clinics. Community Alliance has one of those. You can go into Community Alliance, meet with their rapid response team, who will ask about what's going on, why they came in, what their story is. Ask them what resources they might need. So that could indicate whether it might be good for them to get some education in our day rehab program, or maybe they would be a good candidate for a team because they've had an attempt recently where they struggle with chronic suicidality. So they can make recommendations to people from there. There are also, like I said, ERs, urgent care centers. There's places you can find mental health providers online, psychology today. There's lists of people in your area. If you have insurance, obviously, your insurance usually has lists of providers for in-network. There's a suicide prevention lifeline. There's a website for it. This number has, everybody know what the new number is. 988. It is way easier to remember than all of those digits, right? You can talk to people on the phone with that. You can also text them. For the person in crisis, you can do that on your own. If you know someone who's in crisis, you can call for them and say, hey, I'm sitting here with someone. Do you have any advice? Right? They will give you that advice. They're trained counselors on the other end of the line. It's not to. Right. Asking increases risk. So that's what I have. If you have questions, I have, at this point, like she said, trained over 2,000 people. So I've got a lot of different kinds of questions. And I've looked up lots of different answers to those questions. Local resources or anything like that. Just so you know, we do have some extra information about workplaces that do have higher risk. And a community alliance, in addition to those resources, I said, community alliance has a space that is called Safe Harbor. It is on 25th and Kearney. And right, if you've ever heard of Lasting Hope Recovery Center, it's in the same building that it's close to like the Jocelyn Art Museum. But they have a resource where it's all peer support professionals. That is people who have been through training, secure in their recovery, and they've gone through, it's like 40-hour training plus hours on the job, plus a state exam. And they've been there before crisis. So they welcome people in to their space. They have 24 hours to get through that risk period, the high risk period. That's if somebody is manic, if they're suicidal, if they're facing crisis. They don't have to do it. Lots of slide on that table. Please take. We haven't ordered much in a while because we haven't needed it. And our grant is up at the end of September. So we can just, if we can just get these out to people, great. As many people as we can.
I liked your presentation. Thank you.
Thank you. I can't really take credit for the presentation myself.
But we did a good work presenting.
Thank you.
Shouldn't we have a bunch more sandwiches back there? You guys can take some for lunch tomorrow, dinner tonight, whatever you want. And also, thank you so much for coming and speaking to us. I really appreciate it. And I know I learned a lot, and I hope that talking about it, we can make some changes. I have some posters that I made back there and some stickers. I would really like it if you guys could take one or more than one, if you want, and post them on your job, like at your job sites, your offices. It just has some as the 988 number that she talked about, and just a few of the warning signs to watch out for. But it would be a way that this message beyond this talk. Once again, I just want to thank you all for joining us today, and have a great rest of your day.